The Department of Health targets to finish tonight the inoculation of all residents evacuated near the Taal Volcano that belongs to the priority groups. Some healthcare workers from other areas were deployed in evacuation centers to hasten the vaccination process. Health education and counseling of residents are also being conducted to convince more to have their COVID-19 jab. With this measure, COVID-19 transmission will be prevented among the evacuees.
Nagpadala din po tayo ito, karagdagan na bakuna. Meron na po 3,000 na mga bakuna na ipadala. Nagpapadala ng 2,000 pa. No? Para sa gano'n, magkaroon ng sapat na coverage.
Aside from the 3 million worth of medicines for skin, eyes, and for those who have respiratory problems, the DOH has also allocated additional COVID-19 vaccines for more than 3,000 evacuees in 95 evacuation centers.
Naging direksyon na rin po yan at desisyon ng ating vaccine cluster together of course with our officials na talagang dadagdagan po natin yung mga allocations natin ng bakuna sa mga piling lugar na ito. Dahil gusto natin maprotektahan yung ating mga kababayan na nandun sa mga evacuation sites and also affected by this kind of incidents.
Pupuntahan din natin ang mga iba pa apektadong lugar na kung saan meron pong evacuation centers at tinitingnan po natin sapat ba sa mga gamot laban sa mga karaniwang karamdaman na nararanasan ng ating mga kababayan dito.
The DOH Calabarzon also ensures they will immediately test, separate, and isolate symptomatic, suspect cases, and close contacts to prevent transmission in evacuation centers.
And the RRMC has provided more than enough test kits for the current evacuees. So lahat po ng permitted na mabakunahan, meaning those above 18 years old, will be vaccinated.
Kaya ngayon, ang ating lalawigan, yung ating mga ilang evacuation center, ating i-convert na sa health facilities, isolation units. So ngayon ay gagamitin muli. At yung mga paaralan ay magagamit din natin as evacuation center.
According to the DOH, aside from the threat of volcanic eruptions, LGU should also prepare for possible onslaught of typhoons amid the pandemic. Evacuation centers should be properly ventilated. There should also be enough water supply for hand washing and bathing of evacuees.
Kailangan merong distance ang bawat pamilya sa bawat isa. Kung maaring gumamit ng mga eskwelahan na merong mga maraming kwarto na maaring magkaroon ng isang pamilya per room. Kung sakasakaling posible lang po para mas safe tayo, tent per family, no? So kung magagamit natin yon because these are also engineering controls. Barrier po yan para dyan.
The DOH wants to ensure that the situation in evacuation centers will not be super spreader events, so transmission should be prevented, especially with the threat of the more transmissible COVID-19 variants. Case trend in regions should also be monitored to avoid overwhelming of hospitals and shortage of medical frontliners to man and treat severe and critical COVID-19 patients. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.